Hello everyone, I am Dr. Milind Jambagi, Consultant Pediatric Intensivist and Pediatrician at Ankura Mother and Child Hospital, Pune, India. I head this intensive care unit and we have a tertiary level 10 bedded pediatric intensive care unit in this facility. I would like to take you through the ICU, which we use it to save sick children. So there is a lot of technology involved when we have to save sick children in our intensive care unit. There are few of the equipments which I would like to take you through. This is called a high frequency oscillator, which is used in a child who is having very bad lungs and severe pneumonia. We have different infusion and syringe pumps which we use to give medications to our sick children. There are specially designed and safe beds for the children. We have a multiparameter monitoring device which is called a Multipara monitor. This is called the mechanical ventilator, which we use again for children having pneumonia and other lung issues where the child needs respiratory support. There is another machine called high flow nasal cannula oxygen, which delivers oxygen with high flow to children with respiratory problems. This is a very special device and equipment called a CRRT machine, which we use for children with kidney issues who need dialysis. We have a beautiful 10-bed and well-equipped tertiary care intensive care unit where we have well-trained nurses who are specially trained in treating children with intensive care requirements, and we have to maintain this unit very clean and neat to prevent the infections to all these sick children, because they are very much prone to getting infections. For that we have very well trained housekeeping staff as well. I am the intensivist. Along with me I have a team of 4 doctors who look after the sick children in this 10-bedded pediatric intensive care unit. As you can see, there is a sick child being treated here, and these are all the equipments which we need to save a sick child. So there are different syringe pumps which deliver medicines at a very precise and prescribed dosage, which is very minute. And this is a monitor which tells us about the different parameters and the vitals of the child. As I was telling you, this is the ventilator, wherein the machine delivers artificial breaths to a patient who cannot breathe for themselves. And as I take you through, coming out, as the children in intensive care unit are really sick and they have less immunity power, we have to maintain very strict hand hygiene and infection control policies in treating such sick children. That's why we maintain a very strict hand hygiene policy and isolation. We have 2 different isolation rooms in our intensive care unit, because there are some children who require isolation rooms and they must be treated away from other sick children because of their special requirements, like they might be having less immunity to deal with and they might be really sick where they can catch infection from other children. So I'll take you through this part of the ICU. So we have one isolation room here, and there is another isolation room here, and we need to maintain a specific pressure inside and outside of these isolation rooms. That's why we have pressure monitoring gauge as well. Thank you.